Methicillin-resistant Staphylococcus aureus, also known as MRSA. MRSA is a type of bacteria that infects the body's own white blood cells, making it a very dangerous and sometimes life-threatening bacterial infection. What makes this infection so hard to treat and so dangerous and life-threatening for some patients is that it has become resistant to many of the commonly used antibiotics, such as penicillin. Because of this, it has been given the nickname the superbug, making it very difficult to treat and control. MRSA has specific enzymes that allow the bacteria to penetrate and destroy host tissues. It can be found in the urine, blood, bones, joints, and soft tissues of the patient. This can be spread through direct contact of the skin from patient to patient or healthcare provider to patient. It can also spread to any organ in any part of the body. MRSA can be contracted by various ways, especially through open wounds in the hospital or in healthcare settings. When contracted in healthcare settings or after surgery, it is known as nosocomial MRSA. Although many of us carry Staphylococcus aureus on our nose and on our skin, it does not pose a threat to others unless the bacterium becomes active. The appearance of the infection depends on the severity of the infection. It may first start out as an appearance of a pimple or a bug bite, or there may also be other areas of the skin infected, leaving a large rash or surgical site infection. The most commonly places that the infection are transmitted through are through open wounds or cuts in the skin. Since this infection can invade multiple body systems, it can also cause other impairments such as weakness, confusion, and decreased functional levels. MRSA does not discriminate, and anyone of all ages and ethnicities are capable of getting this infection. However, those most prone to getting this infection are those in the nursing homes, hospital settings, and mainly the ICU, because they have so many IVs, lines, and usually have catheters for a very long time. People who have taken antibiotics for a long period of time are also very susceptible to contracting this infection because their body has built up a great immune response to the medications given to them. In order to diagnose the infectious bacteria accurately, doctors will take a tissue sample from the wound area or a nose swab and run diagnostic bacterial tests in the lab. Once under the microscope, doctors are able to tell whether MRSA is present or not. After being diagnosed with nosocomial MRSA, the patient is put on precautions, and anyone entering the room is required to wear PPE. Personal protective equipment is very simple to use and usually only consists of gloves and a gown. Although a mask is not required, it is sometimes worn depending on the severity and the location of the infection. It only takes a couple of seconds to put on the PPE. However, nurses and doctors are big offenders of this protocol.
Hi, I'm Nurse Emily. We're just going to flush your IV out for therapy.
Okay.
Well, let's go check on my patient today. Oh, she's on precautions. Let me put my PPE on. Knock, knock, knock. Therapy. Hi, Nurse Emily. How's the patient? I see she's on precautions today.
Yes, she's ready for therapy.
Okay, well, I've got my PPE on. Thank you. Hi. You have MRSA.
Yes.
Okay, so you ready for therapy?
I am.
Okay. Prevention is the best treatment for MRSA. Please do not allow a couple of seconds of putting on gloves and a gown be the reason that you spread this infectious disease to someone's loved one. Another simple way of preventing the spread of MRSA is simply washing your hands after leaving each patient's room. Another standard protocol for patients on isolation are for them not to exit their rooms, which can cause several limitations for your therapy treatment with your patient for that day. Because the infection attacks the body's immune system, these patients become fatigued and very weak quickly, causing them to be unable to do simple ADLs such as bed mobility. For these patients, therapy usually consists of in-bed exercises such as ankle pumps and straight leg raises. It is important for the therapist to inspect the wound prior to treatment to make sure there is no unexpected drainage, and also inspect the wound after treatment to ensure that no complications have occurred due to the therapeutic exercises. You should also monitor vital signs and facial expressions of your patient to ensure that they are not in too much pain and that they can tolerate your session for the day. Because the patient is restricted to in-room activities, getting the patient moving and transitions to different positions is very important. Even if the patient cannot ambulate, it is important to get them to the edge of bed if possible. Getting them sitting in the upright position will benefit their vestibular system and also help regulate their vital signs if they are having issues with that. Nosocomial MRSA can have a prognosis that ranges from good to poor. If the infection is caught in time and treated properly, patients can typically recover and have no residual effects or disabilities. As a physical therapist assistant, it is our goal to ensure that our patient returns to the prior level of function that is most achievable. It is imperative to start effective treatment and allow the patient enough time to recover while keeping them mobile and keeping range of motion to ensure no contractures occur during their hospital stay. So remember, MRSA is a very aggressive pathogen that is a common infection among those in healthcare settings. Simply washing hands between patients and maintaining sanitary patient rooms can easily prevent the spreading of this potentially life-threatening pathogen. Since healthcare providers are in continuous contact with several patients, nosocomial MRSA is quickly growing into an epidemic affecting many people due to these professionals not adhering to hand-washing standards. Although it is not a standard procedure to screen patients for MRSA upon admission to the hospital, this would be an effective way to isolate patients who are predisposed to MRSA. Hospital and long-term care facilities make up the most common places MRSA is contracted and also are the places where people with the weakest immune systems are. These two factors create the perfect condition for MRSA to thrive and spread to others. Education is key to treating and controlling the spread of nosocomial MRSA. It is important for patients diagnosed with this infection to maintain the highest level of function and mobility through physical therapy. Therapy for these patients may consist of bed exercises and short ambulation distances to prevent further impairments and complications. Don't let a few seconds of putting on gloves and gowns and a few more seconds of washing hands be the reason you spread this infection to many, many others in these healthcare settings.